When cybersecurity fails in healthcare, it's not just data that's at risk, it's the people. We didn't fly to Minnesota just to attend a conference. We came here because long-term care matters to us. This isn't just any conference. This one is personal to me. This is my home state, Minnesota, where I grew up, and to be able to fulfill my purpose of supporting the long-term care community, to be proactive with their technology and cybersecurity here in my home state, it's really meaningful to me. Well, we are very active in the healthcare associations in New York and New Jersey. This is our first time at Leading Age. So where better to take that leap than here in my home state of Minnesota? I love working with these long-term care associations and organizations because it's never about maximizing profit or pleasing shareholders with them, but rather providing a way for our seniors to live a life that's truly meaningful. Long-term care is healthcare after all, so they depend upon an always-on care system that has a very low tolerance for downtime. And with the staffing pressures that they face every day and the regulatory burdens being placed upon them, it's a constant struggle. This creates a significant challenge because long-term care is also critically fragile. The technology systems and processes that most long-term care organizations have in place are incapable of supporting the needs of the modern resident. They're also highly reactive and woefully unprepared for the cyber threats that they face today. Most long-term care organizations, they have IT support, cybersecurity, and probably some level of HIPAA compliance in place, but it's mostly tactical. Their technology is about keeping the lights on. Cybersecurity is reactive and compliance is paperwork and check the box, not real risk management. The dangerous part is that IT cybersecurity compliance are usually siloed and nobody owns the full risk picture. The work we're committed to is removing the dangerous silos between IT cybersecurity and HIPAA compliance. These should never be separate conversations because they're one risk conversation. Our goal is executive ownership of technology risk in the long-term care space. Because when that risk is governed properly, uptime improves, cyber risk drops, and leadership can actually defend the decisions they make. Got lots of stuff going on here. Got our nice little Plinko game. Tissues, hand sanitizer, hockey pucks. They put me on a sticker.
So these conversations really matter because they're just not being had today. Not only are these conversations not happening, but they need to happen in order for healthcare leadership to have a better understanding of their true risk.
Uncertainty because they have IT and compliance in place, but they're not always confident that they're doing anything and everything that they need to be doing.
When we talk with long-term care leaders, the goal isn't to overwhelm them with technology. The goal is to create better outcomes. Leaders stop being blindsided by security incidents, by audit findings and downtime events. They understand their risk before it turns into an emergency.
Most people we talk to, they genuinely just want clarity. And once they have that, the path forward becomes obvious.
Technology supports care instead of interrupting it. Systems remain available. Staff workflows stay intact. And when technology is stable and secure, caregivers, they can focus on residents, not workarounds.
And I'd say a lack of clarity because when there is a breach, they don't know who actually is supposed to own the risk.
Executives can explain their technology risk posture, make proper business decisions without fear, and defend decisions to boards and regulators. That confidence matters, especially in an industry under constant scrutiny.
You can see the relief when leaders realize that they don't have to figure this out all on their own.
Got hundreds of leads, gave away hundreds of tchotchkes.
Yeah.
And it is time for some Starbucks. It's not just checking HIPAA boxes, it's actually being prepared for cyber incidents, operational disruptions, regulatory reviews. See, compliance doesn't protect residents, resilience does. This is what we're working toward. Long-term care communities that are safer, more resilient, and financially sustainable. So they can keep doing what they were built to do, support meaningful and rewarding senior life. This is just one of more than 10 trade shows in the long-term care space we'll be attending this year. The Continuous team and I will be traveling across the country, showing up to meet with new people, network, and spread our knowledge and awareness about technology risk governance. It's important to give back to these communities who are doing so much for our seniors, and showing up in person, that truly matters. Long-term care deserves partners who understand their issues, their obstacles, and their mission. And if we want seniors to live safe, dignified, rewarding lives, then the systems that support them, they have to be safe too. I'm thankful for the people that we've met here. I'm thankful for this industry, and most importantly, I'm really just truly thankful for its mission.